restorations with the PICASSO laser in the palatable aspect. And we're using the laser here at 1.4 watts, 30 microsecond pulse duration and 30-second interval. You can see that there's very little charring. The tissue is just getting a little white. You get a little bit of a coagulum on the end. At this point, you want to wipe that off. You know, see, I stop, and then you want to wipe that off so that you don't leave it there. And you're just trying to use small brush-like strokes with the initiated tip to try and create a retraction of the tissue and have access right at the gingival aspect. So the one that's being completed, now we're moving over to the canine. You can vary your settings on this if you want to try something without anesthetic. Again, 0.6, 0.7, 0.8 watts continuous wave, 1.2 watts, 30 microsecond pulse on, 30 off. You can also try it 20 and 20. That is a little bit less likely to allow you enough tissue relaxation time. So again, you can see here that when the coagulum builds up, here's the cannula, Teflon coating, and finally the quartz. The cladding is the portion here, and you can see the initiated tip there, again being able to use, and very little charring, just little bits of charring here, but very little charring, and within 30 seconds to 45 seconds on each, you can quickly just zip away your tissue. Don't move the tip too fast. If you're moving the tip too fast, you're going to get bleeding. Don't move it too quick, because you're going to actually use the tip like a knife then, and you'll actually get bleeding. So there it is right after the reflection has occurred, and you can see at high mag, between 8 and 13 times magnification. You can see the initiated tip, and I'm just going to drag it through and remove maybe a millimeter of soft tissue there in depth. It's not so much the depth, but just trying to get it removed away from the margins of your preparation so that you don't have to worry about sulcular contamination there. When you get a little bit of coagulum on the tissue, on the tip, you need to stop and remove it. If you look closely, you may see that there's maybe a little bit more carbonization occurring here, which would tell you that perhaps it's time to just lower your setting. And again, you can see it's short brush strokes and trying to just remove that superficial tissue to create a better margin there for yourself. Without anesthetic, it's 0.6 watts and continuous wave. And you can see I'm going at short brush strokes to try and create that trough, looking for tissue that's overhanging. And as soon as you get a little bit of coagulum on the tip, it's time to change the tip, or time to remove the coagulum. You will sometimes get little pieces that are left on the margin that you'll remove either with your hydrogen peroxide or with a small brush. And you're just going very, very slightly into the sulcus. Okay. Again, the key is don't go deep. You don't need to. That's why magnification is so key, to be able to see how deep in the sulcus you are. If you look at the facial aspect, you can see here on the distal facial, or this aspect, the line angle, that the tissue is still slumped on the margin here. And you can see as we move it in short brush strokes, just to create lateral distension. There you can see a little tissue tag. And again, high magnification of 4, 4.5 and above will allow you to use lower settings and to be able to more clearly discern where your margin is, because you're moving away from a tactile environment to a visual environment. No bleeding, tissue is troughed off the margins, and this is your initial gross reduction of tooth structure, and then your diode troughing to get your tissue away from your edges. Lower magnification, you can see the overall result looks pretty good. Here it is at 2 power, and at 2 power again you can see the nice result. Here's the tissue equigingival. This is a frenectomy with the PICASSO laser, and you can see it's a lower one that was done because it was pulling in this area here. And we just used the laser. When we were pulling on the lower lip, you could see that it was blanching in this particular area and being very close to the bridge that we were doing in this area. So here it is at high magnification, again with an initiated tip. And you could use 2.2 watts, 30 and 30, or 20 and 20 here. and just dragging across. You can see it's touching first and third base, very little charring occurring, and I'm pulling the lower lip as I'm moving horizontally across the fibers. No bleeding is occurring because, again, the diode laser is well absorbed in hemoglobin and also well absorbed in melanin, and you're getting very little interaction with the tissue in a necrotic form, because you can see. I like to move the lower lip both up and down and sideways to see where it's attaching. So you'll see me pulling on the lip and pulling sideways just to see where the attachment is. It gives me visually a good idea of whether